Greetings, everyone. Welcome to our podcast. This podcast is due to the support of Elegant Aesthetic Solution Med Spa in Chatham, New Jersey. We are going to continue today on health, that is, health maintenance. Last time we talked about what good health is, what are determinants of good health, and we segregated health in terms of mental health and physical health. We talked about how genetic and environment play a role. And we talked about the 10 most common causes people visit doctors or providers, and the 10 most common causes of death in the United States. And one thing that we need to stress more, that is, as we talk about chronic disease, but one thing that's so bottom, so basic to good health is prevention, especially in countries such as Cuba, China. In other words, countries where prevention and is so key to keeping people in good health. So we're going to talk about that today. And when we talk about prevention, we're talking about prevention in terms of the environment and also prevention in terms of personal. That is, when we speak of the environment, and we're talking about first where you live, that is your geographic location on the planet, location in your town. We talk about education because education is very important in terms of your outlook on life, your altitude, as you say. Cultural beliefs, very important. And also safety at home and at work. These environmental factors, as you modify them, they will help to prevent chronic diseases. And we'll dive into that a little bit more. With respect to personal prevention for good health maintenance, it has to do with lifestyle. Lifestyle has to do with avoiding stress, mitigating things that will keep you from doing the stuff that is good, like exercise. So that's lifestyle. Nutrition also is very key in terms of personal aspect of prevention because diet is, again, fundamental. That is, you are what you eat. It's so important. Now, when we talk about diet, we mentioned, as we said, Mediterranean diet. There's a bunch of other fat diets that they're too numerous to name. But when we look at the diet that's going to keep you living with less chronic diseases, it's going to keep you living longer in better health, that is the Mediterranean diet. There's Dr. this diet, Dr. that diet. But when the CDC or the NIH look at all these diets, they compared in terms of longevity and chronic diseases, the Mediterranean diet. I myself, when I used to be more active in doing weight loss procedures, we would put these people on a diet that is, especially around the time of the procedure, would put them on clear liquid diet, and then they would go to what's called full liquid diet, and then regular diet. But these diets are temporary, and that's just a means to an end. And also, people who had heart operations, they would put them in this cardiac diet. There's a famous, I believe, either Cleveland Clinic or Minnesota diet. It's a cabbage diet, where a lot of people would make this soup and made out of cabbage with tomatoes, onions, basically some flavoring. They would drink that soup over a week, and that soup is supposed to help decrease their cholesterol and prepare them for the usually used to be open heart procedure. And they would also lose a fair amount of weight because cabbage has no calories and flavoring for the soup have no calories. The diet would work as such, where they would bake this big basically big bowl or of cabbage. They would shred it, and they would add all the ingredients. They would use vegetable stock and flavor it with tomatoes. The first day, all you can eat was soup and fruits. Second day, soup and vegetable, no fruits. Third day, soup, vegetable, and fruits. Fourth day, they can have soup and all the meat you can eat. All the meat. And then the next 2 days will be a repeat of the first 2 days. Most people would lose anything from 8 to 10 pounds in a week doing that diet. But that diet is not tenable. You can do it around the time you have an operation, but again, it's a fat diet. So, diet is very important in terms of personal health maintenance, but yeah, we'll go deeper. So, now let's get back in terms of the prevention and the environment. Yes, education is the first aspect. That's something you have control over. Um, it's been shown that the for the most part, education is education at home and education, academic education. But the higher you go, the more apt you are to implement what you've learned in terms of diet and in terms of good eating. As we said, you want to do those things, engage in those activities that will enable you to maintain good health. For example, education will help you attain, for the most part, certain standard of living. We know that with good education, and of course, there's a luck factor. It's who you know that's as important as what you know, and sometimes more important. So, with education, you are able to scale the social ladder. And with education, chances are, if you start in the rural plains of Alabama, Mississippi, or Arkansas, and you move to the upper east side or upper west side, or Orange County in California, chances are the fact that you change your zip code and access to healthcare, chances are you'll get better quality of healthcare and you'll be able to afford the cost. So education is a very important part in terms of doing those things that will prevent those chronic diseases that we talk about. Education will allow you to live in those neighborhoods that give you better access, quality, and you'll be able to afford the cost. So education plays that role. Cultural beliefs are very, very important. For example, uh, the Hopi Indians, they are Indians that used to live in the Southwest. Uh, there's noted to be a preponderance of diabetes to these Indians. That is more than the average population. They notice more diabetes in these Indians. But culturally, these Indians would go through seasons where there are a lot of famine. And because there are lots of famine in terms of their geographic location, uh, the fact that their bodies will allow their blood sugar to sustain their bodies, this was a survival mechanism. So cultural, Hopi Indian, and environment, and the fact that when they were able to elevate their blood sugar better than the other people that live in the neighborhood, and that is in that geographical location, this was an adaptation that was good at a particular time. But now, in this time of basically plenty in terms of agricultural and food production, it turns against them. So, cultural beliefs relate to environment, how it can help prevent or maintain good health. And location is also very, very important. That is, as we said, where we live geographically on this earth is very important. We talked about the neighborhood. And even when you live in some location where, for example, let's say if you live in area where there's a lot of flies. When I say flies, I mean not so much flies, but uh, area where there's unsafe water. For example, we know that there's a town in I think it was Michigan where the water was not healthy at all. It has a high content of lead, and because of that location, we know that lead affects the brain of children, causes underdevelopment, and which become problematic as they get older. So being in the wrong location and can affect your health negatively. So what you want to do is make sure that you are able to move to a proper location where these environmental factors are least likely to affect your health. So that's very important in terms of environmental factor that can help prevent basically chronic health outcomes. Safety at home and at work. And all of them are tied: education, cultural beliefs, and location. Safety at home. If you're living in the proper home, you want to make sure that certain things are taken care of, especially if you have, let's say, children, you have young children, especially depending on the age. You want to make sure safety at home means that you have all the outlets covered, especially if you have toddlers that are crawling. And you make sure you have all the chemicals that you use to clean safely put away. Safety at home mean that you have well lighted areas, because sometimes if you live in an area that's not well lit, that can attract certain undesirables in terms of people. So safety at home that also is important. And safety in the place of work. For example, as a healthcare worker, I myself, especially as a surgeon, I have to take certain precautions because I deal with sick and diseased people. And depending on the reason for which the individual is in the hospital, for example, one of the precautions that I have to take is make sure that I treat whoever I'm working with as if this person has HIV or hepatitis. And that's because to make sure that I take precautions, I wear my gloves, especially if I'm operating, and I double glove, so that in the case that I don't bring any of this stuff home, because you can catch this stuff through accidents at work. So safety at home and at work is paramount to good health maintenance. Last example I give you is during COVID, where I used to work in one of those COVID field hospitals. And that's at the time, we're talking about from February 2020 to May 2020, where I used to work at in New Jersey in the 3 COVID hospitals, and that was before they had the vaccines. So the typical workday would be, first of all, the great thing about that time was there was no traffic because everybody was quarantined at home. So getting on the parkway at 8 a.m. and not having any traffic, that was great. And also being able to gas up in any gas station free of charge, because I was a healthcare worker. So that was the upside from COVID for me. But anyway, going to the COVID field hospital, on arrival, they would take your temperature to make sure that you're not bringing anything in, that you are okay. Then you would go sanitize your hand, put on these personal protection equipment, mask, double mask, double gloves, and then you would go in to one area that had positive pressure. So then you would go and take care of the clients. But taking care of the clients mean that you wear this protective gear so that you yourself don't become ill. And when you are leaving work, you come home, but you have to leave the gear at the site of work, then change into your own clothes, and then come at home. Now, once home, you have to make sure that to decontaminate, that is, you cannot, initially you could not get in contact with the family because people were very, very concerned as to how, and uncertain as to how COVID is distributed. So you have to take a physical distance from your family. And it's only after the research proved how COVID was mainly spread through spray, in other words, through air droplets, and the whole thing about on surfaces was least likely. That is, most people caught COVID through air droplets versus surfaces. Then it was more. It was understandable that you didn't have to quarantine as much. But again, these experiences at work influence how, or steps that you need to take to prevent spread of disease at home. And we're talking about health maintenance. So depending on how you work, where you work, will determine the precautions that you have to take to make sure that you don't bring disease home or keep yourself and your family in good health. If you're working under places where you have chemicals, whether it's Johnson and Johnson, where you're dealing with a company especially that develops antibiotics against bacteria, well, you got to take certain precautions. If you're an engineer, you work in areas where you have chemicals that may be carcinogenic, you have to take precautions. So work influences how you basically mitigate the environment, so you make sure you prevent diseases from affecting your health and your family's health. So again, we're talking about how to prevent chronic diseases in terms of your health, and we're talking about the environmental aspect of prevention. Now we're going to go back to a personal aspect of prevention. We had initially started about nutrition. Nutrition, again, is a fundamental thing that you have to make sure you get right. You, to the extent possible, as we said, you have to focus on eating fruits and vegetables, particular fruits, particular vegetable. And we're not really necessarily talking about starches, because a lot of people think of potato is a vegetable, but it's a starch. When we talk about fruits and vegetables, we're talking about the green leafy vegetables, legumes, and so on, and nuts. These are things, if you can go to your local nutritionist or your physician, most of them will have a list of what's called good fruits and vegetables for your nutrition. But nutrition is key. We talked about the Mediterranean diet over and over. So I would behoove you to familiarize. And all these things you can get from the internet. You could Google Mediterranean diet, get it from more than one source, and then adapt it as you see fit. And that's a diet also you can adapt to your culture, because we know that Europeans versus Africans, Asians, everybody eats a little different, but they can combine and learn from that Mediterranean diet and adapt it to their own particular, put their twist to it. So nutrition is very important. Lifestyle also is a highly personal factor that influences health. And lifestyle, we're talking about number one, diet and exercise, and also abstain from things like alcohol, abstain from things like cigarette smoking. Although now the new kid on the block is CBD, or CBD, in other words, one of the derivatives of marijuana. It now is becoming clearer and clearer. It has been shown that although so far it's not been shown that marijuana causes the same type of cancers that cigarettes used to cause, but now over and over it's pretty clear that marijuana definitely causes cognitive decline. That is, people who smoke, people who eat. It's been shown that cognitive decline, that is, that fog that your mind goes into as you get older, is increased with the consumption or ingestion of CBD or THC. So just like we see that with alcohol, uh, as we're talking about liver disease and chronic liver disease, alcohol is the number one cause of cirrhosis or liver disease in the United States and in industrialized countries. And you see a fair amount in countries like Cuba, where there's a lot of where there seems to be autocratic state. So lifestyle, we're talking about marijuana, we're talking about um, all the stuff that causes illness, and these are stuff that you can prevent. And another one that also slowly creeping, the use of the internet, especially among the younger age group. We're seeing a lot more depression in the younger age group because of the internet. They tend to use the internet as a means to socialize, uh, because of the lack of social contact. It's been seen that a lot of younger people nowadays are depressed, and these depression can become really clinical, where they have to seek and get professional help. So, lifestyle, addiction or lack thereof, uh, and using the internet appropriately, all these things are very, very important. For example, most parents think that they're doing their children a favor by giving them a cell phone. Well, all the data have shown that until the kid is 15 years old, to give them a cell phone to contact parents, play with friends, is a disservice to that child. They're not mature enough to really understand the permutations of using a cell phone. So I have two 10-year-olds, and until they get 15, or maybe even 16, yes, they'll see a cell phone, but having their own, it's very, very unlikely. So, lifestyle is again very important in terms of prevent uh, chronic health problems. And when we're talking about the mental aspect of health, yes, internet in the young kids is particularly problematic. Exercise will be the last thing that we will talk about. We mentioned that again, exercise doesn't have to be fancy. Simple walking, 3 times a week, half hour per day. Correction, 3 times a week, half hour. And during that time, make sure that you exercise where you increase your heart rate over 100 beats per minute for at least 20 minutes. How do you know it's over 100 beats? Usually, when you're out of breath, it usually means it's over 100. So that's very, very important in terms of exercise. So to recap, today we talked about uh, how to prevent chronic diseases. There are two subdivisions. That is, you have to do things in the environment, and you have things that are person have to do with your genetic inheritance to help maintain your good health. You have environmentally, your good health is influenced by education, cultural beliefs, location, and safety at home and at work. And personally, we talked about your good health is influenced by nutrition, lifestyle, behavior modification, diet, and exercise. Okay, thank you. That'll be all for today. Again, this podcast is brought to you by the cooperation of Elegant Aesthetic Solutions, Med Spa, in Chatham, New Jersey. Have a great day. Thank you.